Warnings: Clonazepam has a risk for abuse and addiction, which can lead to overdose and death. Taking this medication with alcohol or other drugs that can cause drowsiness or breathing problems, especially opioid medications such as codeine, hydrocodone, may cause very serious side effects, including death. To lower your risk, your doctor should have you take the smallest dose of clonazepam that works, and take it for the shortest possible time. Be sure you know how to take clonazepam and what other drugs you should avoid taking with it. See also Drug Interactions section. Get medical help right away if any of these very serious side effects occur: slow, shallow breathing, unusual lightheadedness, severe drowsiness, dizziness, difficulty waking up. Suddenly stopping this medication may cause serious, possibly fatal, withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have any withdrawal symptoms such as headaches, trouble sleeping, restlessness, hallucinations, confusion, depression, nausea, or seizures. Withdrawal symptoms may sometimes last weeks to months. Uses: Clonazepam is used to prevent and control seizures. This medication is known as an anticonvulsant or antiepileptic drug. It is also used to treat panic attacks. Clonazepam works by calming your brain and nerves. It belongs to a class of drugs called benzodiazepines. How to use clonazepam oral. See also Warning section. Read the medication guide provided by your pharmacist before you start taking clonazepam and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 2 or 3 times daily. Dosage is based on your medical condition, age, and response to treatment. For children, the dose is also based on weight. Older adults usually start with a lower dose to decrease the risk of side effects. Do not increase your dose, take it more often, or take it for a longer time than directed. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. If you have several different types of seizure disorders, you may experience a worsening of seizures when you first start using clonazepam. Consult your doctor right away if this happens. Your doctor may need to add or adjust the dose of your other medications to control the seizures. Tell your doctor if your condition persists or worsens. Side effects. See also Warning section. Drowsiness, dizziness, tiredness, loss of coordination, or increased saliva production may occur. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A small number of people who take anticonvulsants for any condition, such as seizures, bipolar disorder, pain, may experience depression, suicidal thoughts, attempts, or other mental, mood problems. Tell your doctor right away if you or your family, caregiver notice any unusual, sudden changes in your mood, thoughts, or behavior, including confusion, memory problems, signs of depression, suicidal thoughts, attempts, thoughts about harming yourself. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions. Before taking clonazepam, Tell your doctor or pharmacist if you are allergic to it, or to other benzodiazepines, such as diazepam, lorazepam, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of a certain type of eye problem, narrow-angle glaucoma, a certain blood disorder, porphyria, liver disease, kidney disease, lung, breathing problems, mental, mood problems, such as depression, thoughts of suicide, personal or family history of a substance use disorder, such as overuse of or addiction to drugs/alcohol. This drug may make you dizzy or drowsy. Alcohol or marijuana, cannabis, can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For children, the long-term effects on physical and mental, behavioral development are uncertain and may not be seen until after many years. Therefore, discuss the risks and benefits of treatment with clonazepam with your doctor. Older adults may be more sensitive to the effects of this drug, especially drowsiness and confusion. These side effects can increase the risk of falling. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. However, since untreated seizures are a serious condition that can harm both a pregnant woman and her unborn baby, do not stop taking this medication unless directed by your doctor. If you are planning pregnancy, become pregnant, or think you may be pregnant, immediately talk to your doctor about the benefits and risks of using this medication during pregnancy. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Interactions. See also warning section. Drug interactions may change how your medications work or increase your risk for serious side effects. This document does not contain all possible drug interactions. Keep a list of all the products you use, including prescription, non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include orlistat, sodium oxybate. The risk of serious side effects, such as slow, shallow breathing, severe drowsiness, dizziness, may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. Tell your doctor or pharmacist if you are taking other products such as opioid pain or cough relievers, such as codeine, hydrocodone, alcohol, marijuana, cannabis, drugs for sleep or anxiety, such as alprazolam, lorazepam, zolpidem, muscle relaxants, such as carisoprodol, cyclobenzaprine, or antihistamines, such as cetirizine, diphenhydramine. Check the labels on all your medicines, such as allergy or cough and cold products, because they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, confusion, loss of consciousness, slowed, decreased reflexes. Notes: do not share this medication with others. Sharing it is against the law. Laboratory and or medical tests, such as liver function tests, complete blood count, should be performed periodically to monitor your progress or check for side effects. Consult your doctor for more details. Missed dose. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature away from light and moisture. Do not store in the bathroom. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company.